Hello, thank you for being here. And this is the second episode of the year of the Shattering the Silence podcast. I'm your host, Eric Diaz, and this podcast is brought to you by the National Shattering Silence Coalition. We do a lot of advocacy on behalf of people with brain disorders like schizophrenia and anything that involves psychosis. And we're a group of families, clinicians, people lived experience. And what we do is we come to bring awareness to shatter the silence that's creating barriers to care for us, like me and our loved ones. And there's a saying, nothing about us without us. But at our organization, we say nothing about us without all of us, because we all need to be included. And also, please like and subscribe to this channel. And now, without any further ado, let's get to our guest, Alan Nelson. Alan, good to have you.
Thank you, Eric. Glad to be here.
All right. And Alan, just a brief, let me give you a brief intro. Alan's son, unfortunately, had a psychiatric emergency, and he wasn't able to get services for his son, and he wound up in a facility. Well, actually, I'll let you tell me. Before we get started, where are you from and where do you live now?
Santa Monica, California. Originally from Delaware, but I've been out here 40 years or so.
Oh, okay. Kind of like
Uh-huh.
me. I'm from Georgia, but I was born in California. So Georgia is my
Oh,
home. Got my bread. But yeah, but California is where I was
yeah.
born. And it's fun. Do you ever go back to visit Delaware?
No, my parents passed. I used to go
Oh, okay.
back there. Yeah. Hmm.
All right. It's always fun when you go visit and you get to do non-tour stuff because you have family there. So I love California. All right. And you're here. Tell us what happened um when your son had his psych. Oh, first of all, tell us a little bit about your son.
Sure. Now, Brandon, very smart person. Uh, he really cared a lot about people, sensitive guy. He went to UCLA engineering, aerospace engineering program, and did well there. Do you want me to hop into the story, or
Yeah, hop
yeah,
in.
yeah,
Explain what happened. What happened when Brandon had his I say
psychotic break, yeah,
psychotic break. Yeah.
yeah. It's in some ways kind of a fascinating story. As I mentioned, Brandon was an aerospace engineer, and he was working for a company that was supplying parts to the airlines. He found out that one of the parts was not built to spec. So he went to management, and management addressed the problem, but they didn't want to recall the parts that had already been shipped out. Brandon didn't like that. He thought that the parts should be brought back. So he went to the FAA as a whistleblower. Um, this was, by the way, late 2017. And the FAA opened an investigation, but then they closed it and said that the parts didn't need to be recalled. Right after that, Brandon really started to kind of decompose. He he was living with us at the time, and he'd come home and look on the internet to see if any planes had crashed that night. Um, about 2 or 3 weeks after the FAA closed the investigation, he called a friend of his from high school. He went to Santa Monica High School, who was now a police officer in the Long Beach Police Department, and wanted to meet. And when they met, he asked his friend to either shoot him or give him the gun so Brandon could shoot himself. The friend, being a police officer, called the Santa Monica police, who came and took him in on a 5150, which is a 72-hour hold here in California. That's what it's called, 5150. He got taken to a place called Exodus. He was there for a few days. We were unable to really talk with him because of these HIPAA laws and the like. But we did find out that Exodus was going to thought it should be extended from a 5150 to a what's called a 5250, which is another several weeks. But they sent him up to a acute psychiatric hospital in Pasadena called Los Encinas. When he was there at Los Encinas, we'd go up and see him occasionally, and it was really sad. He was in this lockdown situation, and they were giving him all different types of drugs, and he just wasn't himself, and he still was in psychosis. It was Super Bowl time, and he thought he was going to be embarrassed by being in a Super Bowl commercial and stuff like that. But
And
yes,
let me interrupt you right there. Was there
uh,
anyone, what did you know about did you ever find out your son's diagnosis?
no, not really. Probably bipolar, possibly affective schizophrenia. I mean, these things kind of blend together, as you probably know,
Yeah,
Eric. It's variations on a theme.
it
Uh,
takes time to get the right diagnosis.
it does. I don't think he ever really got diagnosed correctly. But something was happening that we didn't realize, but in retrospect, it made a lot of sense since he lived with us and he had private insurance through Blue Cross of California. These explanation of benefits or EOBs were showing up at our house, and they were only authorizing 3 to 5 days of treatment at a time. And so after he would be there for 3 days, I guess Los Encinas had to get permission to see him for another 3 or 4 days, and the insurance company was signing off on that. But I think it was pretty obvious that Los Encinas was being encouraged to move him along. And so after about 4 weeks, they said he was ready for outpatient program. We contacted an outpatient program near us in Santa Monica, and they said yes, they would take him, but they had to do a phone assessment. And they called us back and they said he's nowhere ready for outpatient. He still thought he had a chip in his head, and the FBI was after him, and so on and so forth. So we went back to Los Encinas and said, "Hey, give us a few more days so we can try to figure something out here." And they said, "Okay." And then they told us about this residential treatment program that was down in Orange County, California, which is south of LA County, called Sovereign Health. And Sovereign was telling us, yes, we have a program specifically for mental health. It's for young adults. Brandon was 26 at the time, and we thought, oh, this sounds perfect. And if I can share my screen here with you, Eric, hang on.
Sure, that'd be great.
I'll show you what they're.
All right. So what you're sharing, what is up on, explain to me what is up on the screen. You got Sovereign.
Yeah, so this was the website that Sovereign Health had at the time, and that they directed us to. And if you look under treatment programs here, you can see that they had all different types of treatment, detox, addiction, and then mental health. And under mental health, you can see that they had all these different types, including, bipolar and schizophrenia, uh, which is where they said, Brandon would be in the mental health program as opposed to the detox and addiction. He didn't have any drug problem. But then they also have, of course, the dual diagnosis because a lot of times the mental health and the drugs go together and eating disorders and blah, 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 so on and so forth. So we thought, oh, well, this is wonderful, exactly what he needs. And we enrolled him in that program. Um, let me stop sharing my screen there. So we enrolled him in the Sovereign program. Los Encinas took him down there, sent him down there.
So
Uh,
Los
go
Encinas transported him themselves.
No, good question. No, Sovereign actually came up to pick him up from
Okay.
Los Encinas, and then they drove him down to their program in San Clemente, California, which is in Orange County. Uh, so he was there for a couple days. He kind of had another episode, psychotic episode, and we think that may have been because Sovereign did not uh, present him his medication to take over the weekend. He went in on a Friday evening. By Monday afternoon, he was back in another acute psychiatric hospital called Mission Laguna, which was close to San Clemente. On a 5150, they took him in there, and another 5150 that got extended. So we were running down there to see him several times, which is about a two hour drive from where we were in Santa Monica. Um, Anyway, he wasn't doing well, and then all of a sudden, uh, we got a call that said, okay, well, he's good enough and we're going to send him back to Sovereign. I got that call maybe at 2 or 3 in the afternoon, and they said they were going to send him back that evening. And it's like, wow, why all of a sudden? And I guess if they can check a list that's saying he's not claiming to be suicidal, he's not going to kill others, be homicidal, or and he can put his shirt on and
Did your son ever
put food
sign
in his mouth, not gravely disabled, then they can release him. I'm sorry.
did your son ever sign a release of information for you?
Yes. Oh yeah. Yeah. He had by that time he had given permission for us to see him. So we were able to go down there and actually meet with him. Yes. Uh-huh. Yeah.
And before your son had his psychotic break, what
Hmm.
did you know about illnesses like schizophrenia and bipolar disorder?
Well, not too much. I did I did know about bipolar. My father was bipolar, and he had bipolar one, which is where you go into psychosis. But that didn't happen to him until he was about 50 years old or so, and I was kind of in college at the time. And I'm glad you asked this question, Eric, because what happened with my father is he went into a program, and this was back in, I guess, the late 70s, early 80s, but he went into a program and he was there for about 3 or 4 months. They got his lithium. They were using lithium at the time, um, and they got those levels kind of dialed in. And he kept on his medication, and he lived a normal life after that.
Hmm.
So we kind of thought, okay, or at least I thought, well, the same thing would be true for Brandon. He'll go into some program and they'll figure it out. But I mean, a long-term program, because this is these serious mental illnesses, SMI, these are nothing that can be solved in a matter of days or weeks, my opinion. I mean, I'm not a professional, but these things take
Hmm.
months, maybe years to try to get under control. But it's clear that the insurance company didn't see it that way and thought that a few days of treatment may be sufficient. And again, as it seems, as long as they can check those three boxes, not going to kill themselves, not going to kill somebody else, and can put food in their mouth, and they're not gravely disabled, they can be released, and they are. And people find their ways into the streets, and then back into the prisons, and so on and so
Mhm.
forth. Um, I'm still not exactly sure how this whole parity law for mental illness fits into this, but to think that 3 or 4 days of treatment is going to cure a SMI is uh, ludicrous, my way of thinking.
I've seen a lot of insurance companies equating even with non-health, like or even like car accidents or something. They'll be like someone who's suicidal, who's say having just a really like loses their job, only needs 4 days of say stabilization. So therefore, in their little insurance code thing, like, oh, he's in the hospital. Someone with a complete different illness needs 4 days, and it's such a personal, individualized. Like this, there, every set of eyes has a different brain behind it. But if you're some insurance adjuster, like, oh, he's in the hospital 4 days because like the old saying, like a bean counter doesn't
Hmm.
the bean has the same value, and they're trying.
Right.
You got bean and humans are so unique and different that the whole kind of okay, he's going to the hospital. This is what he needs, and I find it hard to believe that you whoever the I don't know what degrees these people have, but they shouldn't be overruling doctors when it comes to what someone needs in a hospital.
I don't know what the doctors were recommending back to the insurance companies, but I can certainly believe that that's possibly what happened, is that the insurance companies were
Mm-hmm.
overruling the doctors. Um, anyway, to kind of hop back into the story, so Mission Laguna sent him back to Sovereign, and of course, along the way, they were giving him different drugs and so on and so forth, and they sent his prescriptions to Sovereign. Now, they don't actually send the pills. When they go to Sovereign, Sovereign's supposed to fill the subscriptions. He got back there on the night of March 7th to Sovereign. They never filled his prescription, so he didn't have his medication the next day. They also were supposed to have given us a safety call. They call it a safety call when he arrived at Sovereign that night that we never
Mm-hmm.
got. So the next day we were furiously trying to get in touch with somebody at Sovereign to let us know what was going on with Brandon, and nobody was getting back to us. Um, but kind of fast forward, he was in a group session that day. uh, he was asked a question: if you were an animal, what would you want to be? Well, Brandon loved flying in airplanes, and he said a bird, and so I can go into the Air Force. There was another, what they call clients there. They don't even call them patients, they call them clients at these places. Uh, he said, well, that's never going to happen because you got mental illness on your record now. This guy had been in the military before. And Brandon became very sullen, and then later, a few hours later, started to scream. And they finally got in touch with a therapist who realized that he hadn't been given his medication. I guess Brandon was saying, "I need my medication, I need my medication," and she realized that he hadn't been given it. She got the medication, got over there. It was about 6 o'clock at night at that point. She administered the medication, stayed with him until about probably 6:45 or so. And by the way, we found all this out through our lawsuit that we filed. Um, and by people who were in there who told us what had happened. Um, and then she left, she had told my wife, she was speaking with my wife on the phone, that she would stay with Brandon, but that did not happen. At least she didn't stay very long. So she left probably at about 7 o'clock or so. The rest of the people who were in the uh, residential treatment facility was actually being done in a house. Um, they went down and ate dinner. Brandon went up into his room that had an exposed sprinkler head in that bedroom, and he took the drawstring from his sweatpants and he hung himself at about 7:45. At about 7:55, his roommate ran up to get a blanket to put on. They were watching TV downstairs and it was a little cool. And that's where he found Brandon. There was a 911 call. The house manager didn't know the address of the house he was in, didn't know Brandon's name, knew nothing about his history. Uh, in depositions, the therapist said she didn't even know that he had been just recently released from Mission Hospital, even though Sovereign had sent him there um, a few days or a week or two earlier. So what came out, Eric, as we were going through this and started learning more, is you have these what are called rehabs out here. I guess they're called that across the country, but these residential treatment facilities that are done in houses that primarily are for detox and addiction, but they're really scams. They're scamming the insurance companies. They're not providing professional help. None of the people we found out in our depositions who were taking care of Brandon were trained. They were minimum wage workers, even though they had held out to us that these were going to be professional psychologists and well trained. In fact, one thing that was really discouraging was when the therapist showed up and Brandon was screaming. One of the house managers said, "Oh, well, don't pay too much attention to him. He's just seeking attention," which is, that's really hard to take. But anyway, as we learned more and more and more about this, uh, and our lawsuit continued, I said, I can't stand by silently. I've got to try to add my voice to let's do something about this. The state of California needs to really clamp down on these. I found an organization called Advocates for Responsible Treatment, run by a woman, Lori Giron, who's just terrific. She's down in Orange County. And by the way, Orange County in California has kind of been ground zero for this. They call it the Rehab Riviera. And
Mm.
she's been pushing the state legislature to do something. I joined up with her 2.5 years ago or so. Unfortunately, the state of California doesn't really seem to take this too seriously. There's a lot of legislators down in Orange County who put legislation forward because they understand the extent of the problem. Um, but on a whole, there hasn't been a lot done. I mean, a couple little feel good type of laws have been passed, but nothing significant, which which is a shame. The ones who are fighting back against these fraud rehabs are the insurance companies. And Sovereign, they they won a $45 million judgment uh, against um, Sovereign. United Health did um, about 4 years ago, 4 or 5 years ago. We had our wrongful death lawsuit that settled a couple years ago, 2.5 years ago at this point. Um, and it really does show that these places are fraudulent, and the state, I think, should do more to pass stricter laws and, more importantly, have oversight of these places. And it's just not happening. And there, by the way, Aetna has another lawsuit against several of these operators. So at least good for the insurance companies for fighting
Mm.
back.
Also, I have a question. You mentioned Rehab Riviera.
Yeah.
Was did your son ever have a problem with addiction?
No, no. Like I said, he went into Sovereign because Sovereign was promoting that they had that mental health only program. You saw that smorgasbord there that I
Yeah.
pulled up. They were just niche marketing, looking to get anybody in
So
there through any
so
way that they could.
they were just they had so basically they had a list of all that stuff, but all they offered was addiction.
Well, that
Nothing
was their
like they said.
primary. I mean, that's primarily what they were were involved with. I mean, we didn't know that at the time, but yeah, and this stuff is still going on. It's when you really start to peel the onion back, they have this stuff called body brokering that's going on where people will go out and they'll actually find addicts who they then will get policies out here in California, just called covered California policy. So they'll fly them in from other states. They'll buy them a covered California policy. They'll milk that policy until it's dry, and then they kick the people out onto the street. It's called curbing.
Hmm.
Um, Sometimes they'll take those people and put them into sober rehabs and then give them more drugs. So they'll test dirty and then they go back into the program and it's called the shuffle. There's an excellent movie by a guy named Ben Flaherty that goes through exactly how this has worked with people. And in fact, it's so bad now, Eric, that some of these addicts, that's the way that they keep their addiction going is they'll put themselves into the shuffle. They don't even have a body broker. They just say, hey,
Hmm.
pay me three grand, and they go into a program, and after they're done, they'll get 3, 5, 7 grand. Uh, Go out of the program, spend it on drugs and whatever else, and then go back in again for another several $1,000s.
Man.
So it's horrible. I mean, when I found out about this, I felt like Alice in Wonderland. You fall down that tunnel and or a hole, and you're looking around the rabbit hole, and you're looking. I can't believe that this actually exists, but it does. And for the life of me, I don't understand why the state of California isn't taking this more seriously. And frankly, I think there should be federal legislation passed to stop this stuff.
Do,
The guy who owns who ran Sovereign, fortunately, 7 years later in last or I guess actually yeah this past uh, May finally got indicted. So I'm hoping that when he goes to trial and hopefully gets sentenced, that maybe that will stop some of this and these fraudsters. But right now, the penalties are so light that they'll do it, pay the penalty, and just keep going.
do you think that the reason the state doesn't want to crack down on these facilities is that they at least get people off the streets temporarily?
Oh, absolutely. Oh, absolutely. I think that's exactly the reason. They're just looking for beds to get people, out of sight. And the other thing that's very interesting here is for the same type of basically the same type of programs, if you take Medicaid dollars, which is out here in California is called Medi-Cal. If you take Medi-Cal dollars, there are very strict vetting that an operator has to go through. There's very strict certification for the people who work in those facilities. If you take private insurance, uh, or just cash pay, the vetting is superficial to none, and the certification for the people who work there is limited. So you have the same program. I mean, Brandon, frankly, would have probably been better off if he didn't have private insurance and had gone in on Medicaid, which again would have been Medi-Cal out here. Uh, I don't understand why, and I've made this suggestion several times, as has advocates for responsible treatment. Just raise the standards to the Medi-Cal standards for the private
Mhm.
pay people. Why not do that? And there's never been really a good reason given for why they won't, short of the fact that if you did that, you would lose so many beds and people would be out on the street. So the calculus may be, well, it's better to have beds where people can be inside and off the street and out of sight and out of mind. And if they're not getting really good care, and if there's leads to some deaths, well, we'll accept that as a cost benefit analysis. I mean, that's the only thing I can come up with.
Has
But
the
we're
local
going to keep pushing. We're going to keep pushing, and hopefully they'll do the right thing at some point.
has the local media in California given this issue any attention?
Oh yeah, down in Orange County, the Orange County Register, if you go there, Terry Savorsa specifically has been absolutely wonderful about focusing in on this, and she keeps hammering away. And again, I think over time this pressure will finally build and something meaningful will happen. But yeah, absolutely, the Orange County Register and also uh, KNBC TV Channel 4 has done quite a bit of coverage on this. Not only Brandon's story, which they both of those outlets have covered significantly, but also the whole rehab Riviera, especially with Terry Savorsa.
All right. And what is Brandon's Law?
Oh yeah. So along the way, we did get one of the, as I mentioned, lawmakers in Orange County do take this issue very seriously because most of it is in their backyard. And there was a state senator, Pat Bates, I say was because she got turned out, who really was working on this. And when we met with her and told her what had happened to Brandon and how we were kind of deceived, she did pass a law for deceptive advertising and deceptive marketing for addiction and mental health services. Uh, Whether that has been used, I don't know, but it was very nice of her to pass the law, SB 534, and she did call it Brandon's Law. But so that's kind of one side that we're doing, Eric. But if I can pivot a little bit,
Hmm? Go
um,
ahead.
we did win our wrongful death lawsuit as more and more depositions came forward. The other side said, let's just settle this and be done with it, uh, which was fine with us. We had depositions. We did not agree to any confidentiality, so we can share depositions. We can, talk about the settlement and so on and so forth. But the money that we got from the settlement, we're looking to, well, we thought there's three things that we could look at putting the money towards. One would be legitimate facilities that help people with SMI and addiction problems. Uh, Two would be uh, money for people to get trained to take care of these problems. And frankly, I think that's where the real bottleneck is and why these fraudsters can survive. They're just not enough uh, people trained in psychiatry and a true addiction treatment to handle the vast need that's out there. And I think a lot of the psychiatrists, especially, uh, don't necessarily want to go into hospitals, so they kind of run their own little private practices and deal with the less severe
Hmm.
uh, mental health problems, you can have all different types of mental health problems, but when you get into SMI, you're looking at something completely different. But there just simply are not enough doctors out there who are trained to take care of this, and there's an overwhelming demand for it, and that's why these fraudsters are able to exist. So anyway, number two would be the doctors, but number three is upstream research trying to figure out what causes serious mental illness. And if we can find the cause and why the brain misfires, then maybe we can find cures for the cause. And if if that could happen, then you don't need the downstream stuff because then you don't need that. So we've uh, Brandon went to UCLA. They have a tremendous neuro program there that's run under something called the Semel Institute. And so we recently concluded setting up a fellowship program for somebody that's going to kind of bridge between the wonderful work that they're doing with psychosis, especially schizophrenia, and work that they're doing on the cellular neurobiological side to see if there can't be more progress made in understanding, why does the brain misfire. And having spoken with the doctors over there, the technology is increasing to where that's going to be possible. I mean, it's not only the technology to look at what's happening inside the brain down at the cellular level, but also the computing power. Once you look at the DNA, and there's genetics and epigenetics, and I won't go into all this stuff, but it's very, very complicated process. And then the brain has these feedback mechanisms. So you got something causes and you get an effect, and the effect can change the causes. So it's really, really complicated. But the technology and the computing power, at least these doctors feel, are getting there. And it could be a couple decades or so, and we may have much more insight into this and be able to find cures. And that to me is really what needs to happen here. And so, at least initially, that's where our money is going, is to help with research efforts. So,
Well, thank
yeah.
you for doing that. And one
Mhm.
question I was going to ask, you mentioned early, when we spoke earlier, that they settled the lawsuit, that they didn't want to go to court with you. Just can you describe just the lawsuit aspects briefly?
Yeah, sure. Well, that's a whole other we could go on for hours here. But with the wrongful death lawsuit, that was kind of interesting. The way it works here in California is they have something called the Section 934, something like that. But it's a bad faith for insurance um, law, and basically what that says is if you make a demand to an insurance company and they refuse to settle, and then it goes to court, and you come back with a judgment that's above the policy limit of the insurance company, the judge can say, well, you're going to have to pay more than your policy limit because you should have settled this thing out of court. It was, so obvious that you were going to lose. And I guess it kind of works the other direction too. But anyway, um, uh, our attorneys kept writing demand letters, uh, and every time there were more depositions, they would put more evidence in the demand letter for why they should settle. Uh, the insurance company, of course, this was against the insurance company, business insurance company, not health insurance, but the business insurance company for Sovereign. They swapped out attorneys. They put some new, more high-powered attorneys in there, had a few more depositions, wrote another demand letter, and they said, yeah, we'll settle for the policy limit, which was $11 million, even though our attorney was fairly confident that if he had taken it to trial, he probably could have gotten $100 million or more based on the egregious activity. But I think they just saw that they were going to lose, and if they took it to trial and they had a judgment above that policy limit, that they could be on a hook for a lot more money. So they went and settled with us. We They came back. They wanted confidentiality. We said no, that's not part of the deal, and they came back a day or two later and said, okay, we'll take take away the confidentiality clause as well.
All right.
So
Well,
anyway,
thank you.
that was another interesting experience. I should probably also mention that along the way with the lawsuit, the first thing that they threw up to try to slow this down was it had to go to arbitration because of something that Brandon had signed on an iPad. Uh, when we took it to the trial judge, our attorneys argued that no, this contract really should not be enforceable because of the way it was written. The trial judge agreed. He said that the uh, contract was procedurally and substantially unconscionable, is the legal terminology for it, which basically means even if Brandon had been in his right mind, that contract wouldn't hold up. They appealed that. The appeals court here in California upheld the trial judge's ruling that it was procedurally and substantially unconscionable. And this was pretty big, they made that what's called a published ruling. And a published ruling, only about 5% of their appeals are published rulings, but a published ruling means that it can be cited in the future. So hopefully there will be other cases, and maybe there already have, that aren't going to have to hop through the arbitration hoop, because they can just point and say, well, our contract is very similar to what this contract was. Um, it's kind of a void contract. So that was a nice win along the way as well.
Mhm. All right. Well, Alan, I'm deeply sorry for your loss, but thank you for all the advocacy that you're doing. I know this is a hard subject to talk about.
Well, it is, but it has to be addressed. But we're, like I said, we're on two kind of parallel tracks here. One is helping the good guys out with the research, and the other is trying to get the state to get some serious legislation passed to shut down these fraudsters who are still running around.
All right. And before we close out, is there anything you'd like to talk about before we go?
Uh, not really, except my hearts go out to people who are, have loved ones and are dealing with serious mental illness. And one thing that and again, I'm not an expert on this, and I only have a sample size of people that I've been able to speak with and some things that I've been able to read. But it seems like oftentimes the people who are trying to help them the most, their loved ones, who are trying to help people with serious mental illness, the people with SMI, kind of turn around and push them away, or turn them into the bad guy, which is heartbreaking to me. It makes absolutely no sense, but that seems to be the way it is. But hang in there and keep trying to help them. But as we've seen with a recent event, sometimes that doesn't turn out the best.
All right. Well, thank you very much.
Okay, you bet.